Let's look at how to massage your C-section scar. C-section scars can be tight and develop adhesions, which means that you get a puckering and sticking of the tissue. We need to keep that skin moving. I'm going to show you how you can mobilize your scar yourself with skin movements to help reduce that C-section overhang. What you need to do is place your hands over your scar so that you're fully covering your scar and your fingers are slightly below it as well. Gently slide the skin from side to side initially, as far as it will go comfortably, and then go up and down as well. You may find one side is more tight or stuck feeling, in which case keep going in that direction, or you may find lifting the scar up or taking the scar down feels particularly difficult. So that's starting to move the skin around your scar to make sure that you get the glide between those layers and to avoid that tight overhang that can develop. Secondly, we need to think about the deeper tissue that got damaged around that area when you gave birth. So let's look at a second movement you can do. We're going to sink down into the tummy and release. You can do this with one hand or with two, but you really want to feel that you're getting a little bit of movement down onto your tummy. Go all the way across to your hips and then work your way back on and around, but also above your scar, because during surgery there will be some scarring that develops above your scar through the midline of the abdomen here as well. Have a little go yourself now. Perfect. Keep this movement nice and slow and steady. You can start this kind of self-massage after you've been for your postnatal check. So this is usually round about 6 to 8 weeks after you've given birth. It's going to be much more comfortable if you empty your bladder before doing this. And let's take a look at what position you should get in for this massage. First of all, it's really helpful to have the knees up with a little pillow or perhaps a rolled up towel. That makes it more comfy on your lower back and can release off some of the tension. Make sure your head's nice and comfy as well, so you can do this on the bed. With a postnatal belly, you may find you've got a lot more tissue than my lovely friends here who's helping us for this video. So in this case, if you've got a lot of abdominal tissue, use one hand to hold your tummy out the way so you can get on and do those movements on your scar. So just lift up some of that excess tissue that you've got at the minute, and that's perfectly normal at this stage after having a new baby. One final technique, and this technique is going to help with the tightness that you get across your scar. So we're going to give this scar a little bit of a stretch, but we're going to break it down into segments. Pin and slide, 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 pin and slide. Make sure you go in both directions with this pin and slide move. And this is really going to help stretch out this tight fibrous tissue where your scar is. When you finish your scar massage, always look after your scar with some nice moisturiser, some special scar cream or some oil for your scar. If you've got a raised scar, you might want to think about using silicone, and check out the other videos we got to find out more about scar care.